Hi, Steve from Wandsworth Physiotherapy. So we often get asked, what is patello-femoral joint syndrome? So the patello-femoral joint is in the knee. It's the joint between the kneecap, the patella, and the thigh bone, the femur. And when your knee bends and moves, the kneecap should glide nicely into the thigh bone. Now these surfaces are covered in a nice thick layer of cartilage, and that aids the movement. But what can happen is over time these cartilage surfaces can start to thin, and they can get a little bit of some patches of wear in them, and they can start to cause some anterior knee pain, some kneecap pain. Now, how do we diagnose patello-femoral joint syndrome? Well, it's very much a clinical diagnosis. It depends on what the patient says. So it will typically be kneecap pain, particularly going up or down stairs or walking up or down hill. It can sometimes be brought about by prolonged sitting with the knee in a bent position and the kneecap is getting compressed into the thigh bone, or after a long drive, for example. It can also be brought on by sport. Now, how do we diagnose it? Well, we'll assess your knee. We'll look at the range of movement and the strength. We'll look at the position of your kneecap. We'll look at the flexibility around the knee, and all of these can give us an indication whether you've got patello-femoral joint syndrome. And there's a couple of key tests that we might use. So one of them is called patello-femoral joint grind test, where we simply just squash down the kneecap into the thigh bone, and that's usually uncomfortable or sometimes painful. And another test is called Clark's test, where we just block the kneecap movement and the patient then squeezes their thigh muscle, and again that just compresses the kneecap down into the thigh bone, and again that is usually painful. If you needed to get some imaging, you could have an x-ray and you could look at the position of the joint and whether there's good cartilage cover in the joint. You won't see the cartilage on x-ray, but you'll be able to see the distance between the bones. Or you would have an MRI, and again this can help to establish whether you've got any swelling in the joint, whether you've got cartilage wear and patches of wear on the kneecap or in the thigh bone. So how do we treat it? Well, conservatively, predominantly, and this is done with kneecap mobilization, soft tissue work through the thigh, the IT band, the hamstring, building strength, particularly around the glutes and the thigh and the hamstring, and activity modification as well. So all of these things will generally start to improve patello-femoral joint syndrome. There may be a short course of anti-inflammatories that's required to settle any acute irritation down. And most of the time, these modalities will certainly improve, if not resolve, patello-femoral joint syndrome. However, if you've got more moderate arthritis inside the knee joint, on the back of the kneecap, on the groove of the thigh bone, you could progress on to having ultrasound guided injections to help manage symptoms and prolong the health of your knee. There's a number of things that can be injected. So if you've got a particularly painful and swollen knee, it might need a steroid injection to help settle any pain and inflammation. After that, we might consider doing hyaluronic acid injection or an ultrasound guided PRP injection, and both of them have got research to support them as being effective in managing mild to moderate arthritis, including patello-femoral joint pain syndrome. So if you've got knee pain and you want a diagnosis and you want a treatment strategy of how you can improve your knee pain, get yourself back to doing what you love, then come and visit us at Wandsworth Physiotherapy. We'll be able to assess your knee. We can ultrasound scan your knee. We can give you a diagnosis, put a treatment plan together and try and get you back to the things that you want to do.